The attending physician laughed when she walked in. Another nursing student? Great, just stay out of the way. Dr. Bradford didn't know, couldn't know. The woman in ill-fitting scrubs said nothing, kept her head down, started checking vitals on Bay 3. That's when the first ambulance arrived, then the second, then the third. Mass casualty event, bus rollover, 27 critical patients incoming. The ER descended into chaos. Bradford froze, the residents scattered, nurses shouted over each other. 8 minutes, that's all it took. 8 minutes for everyone to realize the quiet, student organizing triage wasn't a student at all. She was Lieutenant Colonel Alexandra Morrison, former chief trauma surgeon, combat medical officer, and she was about to save every single life in that ER. The ambulances kept coming. Dr. Bradford stood in the center of the emergency department, spinning in slow circles like a man drowning in open water. His voice cracked as he shouted orders that contradicted the ones he'd given 30 seconds before. Move this patient to Bay 4. No, Bay 6. Actually, keep them in the hallway. Someone check on the pediatric case. Where's the attending from upstairs? Get me the chief resident. Nobody was listening anymore. The residents scattered like startled birds, running between bays with clipboards clutched to their chests, but no clear direction. One nurse tried to start an IV line on a patient in Bay 2 while simultaneously answering questions from a panicked family member. Another nurse stood frozen at a computer terminal, staring at a screen full of unprocessed patient data, her hands hovering uselessly over the keyboard. The overhead speakers crackled with more bad news. 3 additional ambulances inbound. ETA 4 minutes. Morrison stood near the supply closet in her ill-fitting scrubs, her student badge hanging crooked on her chest. She didn't move, didn't speak, just watched. 47 seconds, that's how long she gave herself to assess. Her eyes tracked movement patterns, identified bottlenecks, calculated resource allocation. The military training never left. It couldn't, even when she tried to bury it, tried to pretend she was just another nursing student learning the basics. Her brain still functioned like a combat trauma surgeon evaluating a field hospital under siege. Different building, same chaos. The sounds of the ER blurred in her ears, transforming. Helicopter rotors, distant explosions, voices shouting in Pashto. She blinked hard, forced herself back to the present, back to this moment, this emergency room, this crisis. She'd sworn she'd never do this again, but people were dying. The scream cut through everything else. Bay 7. A woman's voice, raw and breaking. My baby. Oh God, my baby. Morrison's head snapped toward the sound. Through the partially open curtain she could see a small form on the gurney. A child, 9 years old, maybe 10. Blonde hair matted with blood. The cardiac monitor showed a rhythm that was about to collapse into nothing. Bradford stood at the foot of the bed, his face white, his hands spread in a gesture of helplessness. He looked from the child to another bay, where an elderly man was also coding, then back again. The paralysis of impossible choices. Morrison moved. Not a decision, not a thought, just movement. Her feet carried her across the ER floor in 6 strides. She was at Bay 7 before Bradford even registered her presence. Her hands were already reaching for gloves from the wall dispenser. Get me a thoracotomy tray, now. Her voice didn't shake, didn't hesitate. It was the voice she'd used in Kandahar when mortar rounds were landing 50 meters from her operating tent. The voice that made 20-year-old medics move without question, because questions got people killed. A nurse turned to stare at her. The woman's face showed confusion, then recognition of the student badge, then something like indignation. You're a student, you can't. Now. The word cracked like a rifle shot. The nurse flinched, then moved. Muscle memory overriding protocol. In emergencies, you followed the voice that sounded certain. You followed the person who knew exactly what they were doing, even if you didn't understand why. Morrison's hands were already moving. She didn't wait for permission, didn't wait for the tray. She grabbed what she needed from the crash cart, her movements economical and precise. Betadine, scalpel, rib spreader. The girl's mother was screaming. Someone pulled her back, held her at the curtain's edge. Morrison tuned it out, all of it. The chaos, the noise, the doubt in Bradford's eyes as he finally processed what was happening. She made the incision. Clean, fast, perfect. Her hands remembered, even after 2 years of trying to forget, trying to convince herself she was someone else, something else. Her hands remembered everything, the exact angle, the precise depth, how to navigate between ribs without hesitation, clamp the Shuda. Intercostal vessels. A different nurse appeared at her side, younger, eyes wide but hands steady. Suction. The field cleared. Morrison could see what she needed to see. Cross-clamp the descending aorta. Move. The girl's heart was visible now, damaged, struggling, but not gone. Not yet. Morrison's fingers worked with mechanical precision. She wasn't thinking anymore, couldn't afford to think. Thinking meant remembering Martinez. Thinking meant freezing. She operated on pure skill, on the thousands of hours she'd spent in surgical theaters and field hospitals and makeshift operating rooms carved out of desert compounds. The monitor flatlined. Morrison didn't look up. Her hands continued their work: massage, direct stimulation, chemical intervention. She called out medication dosages without checking references, her memory a database of protocols burned into her neural pathways through repetition and necessity. The room held its breath. Then, a beep, another, rhythm. The heart restarted. Morrison stepped back. Let the nurses take over stabilization. She stripped off her gloves with 2 efficient motions and dropped them in the biohazard container. 3 minutes. 40 seconds. Bradford appeared at her shoulder. His face had transformed from white to red, shock giving way to anger, or maybe just confusion dressed up as authority. What the hell do you think you're— Morrison didn't look at him. Her eyes were already scanning the other bays. Bay 3, Bay 5, Bay 12. She could see the problems from here, could calculate the sequence of failures about to cascade through this department if someone didn't impose order on the chaos. Bay 3 has a tension pneumothorax. Bay 5 needs massive transfusion protocol. Bay 12 has internal bleeding, needs OR in the next 6 minutes or he's dead. She turned to face Bradford then, her expression flat, empty of everything except cold assessment. You can write me up later, right now. Choose, your ego or their lives. She walked away, didn't wait for his response. Didn't need it. She could already hear nurses responding to her commands, moving toward the patients she'd identified. The shift was happening whether Bradford authorized it or not. Morrison grabbed a tablet from the nurses' station, started creating assignments in her head, triage categories, resource allocation, who could be saved, who needed immediate intervention, who could wait. The military doctrine called it combat triage. Civilian medicine called it mass casualty protocol. Same principles, different uniforms. The automatic doors burst open, 3 more ambulances outside. Paramedics wheeling in gurneys, their voices overlapping as they called out patient statuses. We've got crush injuries, suspected spinal trauma, multiple pediatric cases. Morrison counted, added the numbers to her mental spreadsheet: 31 critical, 19 serious, 8 minor. Bradford appeared next to her. His face had gone pale again. She could see the calculation happening behind his eyes. The realization that this was beyond his training, beyond the controlled chaos of a normal ER shift. We can't. This is impossible. We need to divert. Morrison's eyes went cold, the same look she'd given officers who suggested abandoning wounded soldiers in the field because the tactical situation was too dangerous. We're not diverting anyone. Her voice was ice. Get me a whiteboard. Someone brought it. Morrison didn't see who. She was already uncapping a marker, her hand moving in swift strokes across the white surface. Red for critical, yellow for serious, green for minor. She assigned bay numbers, personnel, equipment needs, time windows. Every doctor got a role. Every nurse got a station. Every available person got a task. She spoke in rapid-fire commands, short, direct, military precise. Williams, you're on Bay 3, needle decompression, then reassess. Torres, get Bay 5 set up for massive transfusion. I need O-negative blood ready in 90 seconds. Jefferson, you're taking Bay 12 to OR. I want an update in 5 minutes. Bradford stood beside her, silent now, watching. The ER began to transform. What had been chaos found rhythm, found purpose, found direction. Morrison turned to a nurse hovering uncertainly at the edge of the group. You. Get me a status update on all critical patients every 3 minutes. Use this radio channel. She pointed to a specific frequency on the departmental communication system. The nurse nodded, moved. Morrison returned to the whiteboard, updated 2 assignments, corrected a resource conflict before it happened. The staff moved around her like a choreographed dance now, each person knowing their role, their responsibility, their place in the larger mission. She'd transformed from dismissed student to commanding officer in less than 10 minutes. One nurse leaned toward another near the supply closet. Morrison heard the whispered question even through the controlled chaos. "Who is she?" Morrison didn't answer, didn't pause. She was already calling out the next wave of coordinated orders, her voice cutting through the noise with absolute clarity. Bay 8 needs chest tube placement. Bay 14 shows declining neurofunction. Get me a CT scan ordered. Bay 6 is stable. Move them to observation. Bay 19 needs surgical consult within 2 minutes. The question hung in the air. But the patients kept coming, and Morrison kept saving them. 6 minutes in, the emergency department had transformed into something else entirely. What that had been pandemonium now moved with the precision of a military operation. Every person had a role. Every role had a purpose. Every purpose fed into the larger mission of keeping 58 human beings alive. Morrison was everywhere at once. Bay 2. She assessed a middle-aged man with crushing chest injuries in 4 seconds flat. Start him on O-negative, type and cross for 8 units. Possible cardiac contusion. I want an EKG and troponin level stat. The nurse moved without question. Bay 6. Morrison pulled back a curtain, her eyes sweeping over a young man holding his arm at an awkward angle. The resident standing over him was preparing a simple splint. "Stop." Morrison stepped closer, felt the arm, watched the patient's face, checked capillary refill in the fingers. That's not a simple fracture, that's compartment syndrome. Get him to OR3 in the next 10 minutes or he loses the arm. The resident's mouth opened, closed. He looked at the patient again, seeing what he'd missed. Go. Now. Morrison moved to the next bay before the resident could respond. 12 minutes in. The staff who'd resisted her initially had become believers. Her commands were never wrong, never imprecise, never hesitant. She diagnosed conditions in seconds that should have taken minutes of careful examination. She predicted complications before they manifested. She saw patterns in vital signs that others missed entirely. A nurse who'd questioned her authority 20 minutes ago now followed her, from bay to bay with a tablet documenting orders without being asked. 18 minutes in, the rhythm held. Patients stabilized, critical cases moved to surgery, serious cases found appropriate beds, minor cases waited with proper triage justification. Then Bradford tried to reassert control. Everyone, stop listening to whoever this is. His voice carried across the department, loud, authoritative, desperate. I'm the attending. I'll be directing care from this point forward. All decisions go through me. The staff paused, looked between Bradford and Morrison, uncertainty creeping back into their movements. Morrison turned slowly. Her face showed nothing. No anger, no frustration, just cold assessment. Dr. Bradford. She walked toward him. Not aggressive, just purposeful. The patient in Bay 9. What's your assessment? Bradford blinked. His eyes darted toward Bay 9, then back to Morrison. I haven't. There are multiple patients requiring. Morrison waited. 3 seconds. 4, 5. Bradford stammered. He hadn't even looked at Bay 9. Didn't know what was behind that curtain. Couldn't fake an answer. Ruptured spleen, declining BP, probable internal hemorrhage from blunt force trauma. Morrison's voice remained flat. Clinical. You have 90 seconds to get him to surgery or he dies. Your call, doctor. She turned away, pulled out her phone, hit a speed dial that shouldn't have been on a nursing student's device. This is Morrison. I need OR2 prepped for emergency splenectomy. Patient is a 42-year-old male, BP dropping, signs of intra-abdominal bleeding. He'll be there in 60 seconds. Bradford stood frozen, his authority crumbling like sand. Morrison snapped her fingers at 2 orderlies. Bay 9, transport to OR2, move. They moved. The patient was wheeled past Bradford. He didn't try to stop them, Couldn't. Everyone in the department now understood the reality of the situation. Morrison wasn't asking for permission. She was saving lives. Bradford could either help or get out of the way. 24 minutes in, the call came from Pediatrics. Twin children from the bus crash, both critical, both deteriorating simultaneously. Morrison took the stairs 2 at a time. Bradford followed, whether out of professional obligation or morbid curiosity, she didn't know, didn't care. The pediatric ER was smaller, more cramped, 2 bays set up side by side, separated by a thin curtain, twin boys, 6 and 7 years old, both with massive internal injuries, both coding. The pediatric attending looked up as Morrison entered, relief flooding her face. Thank God. We don't have enough hands. We can't. Morrison assessed both children in a glance, calculated resources, personnel, time, probability of success. Bradford appeared at her shoulder, his voice quiet now, defeated. We have to choose. We can't save both. Not with current staffing, not simultaneously. Morrison's jaw set. We're saving both. She pointed at a resident. Williams, you're with me on Twin A. Her fingers swung to Bradford. Dr. Bradford, you take Twin B. Follow my exact protocol. Don't deviate. Don't improvise. Do exactly what I tell you when I tell you. Bradford's eyes widened. I'm not qualified to. You are now. Move. Morrison positioned herself at Twin A's bedside. Williams flanked her. Across the curtain, Bradford took position at Twin B with 2 nurses. Morrison's voice cut through the space. Sharp, rapid fire, military precise, clamp. Both teams moved in synchronization, suture. Her hands worked on Twin A, while her mind tracked Twin B's progress through Bradford's hesitant movements. Vitals. A nurse called out numbers from both patients. Push epi, the medications administered simultaneously. Now. Morrison's attention split between 2 critical procedures happening in parallel. She called instructions to Bradford, while her own hands never stopped moving. Guided him through steps he'd never performed under this kind of pressure. Corrected his technique without looking. Anticipated his mistakes before he made them. Clamped the vessel, not that one, the one below it. There. Her own fingers clamped Twin A's damaged artery, suture from the left side, smaller stitches. You're closing an organ, not skin. Bradford's shaking hands followed her instructions. Check BP. Both patients. Numbers came back. Low, but holding. More epi. Half dose this time. The medications went in. Morrison worked in a rhythm that bordered on supernatural. Her brain processed information from 2 patients, 2 teams, multiple data streams, all while her hands performed microsurgery on a 6-year-old child. 31 minutes in. Both hearts stabilized, both bleeding controlled, both children breathing. Morrison stepped back from Twin A. Let the nurses take over post-operative care. Across the curtain, Bradford stood over Twin B, his hands trembling, his face white. But the child was alive. The pediatric ER staff stared. This wasn't normal competence. This wasn't even exceptional skill. This was something else entirely, something they'd never witnessed before. Morrison stripped off her gloves, checked her watch, started calculating which patients needed reassessment. The elevator doors opened. Dr. Patricia Okonkwo stepped into the pediatric ER. 20-year veteran, chief of cardiothoracic surgery. She carried the authority of decades of experience in her posture. Her eyes swept the room. Found Morrison. She froze. Alex? The name fell into sudden silence. Lieutenant Colonel Morrison? The room went still. Every person stopped moving, stopped breathing. Morrison barely glanced up. Her voice remained clinical, professional. Dr. Okonkwo. Good? Take Bay 14 downstairs. Possible cardiac tamponade. Patient is a 56-year-old female. Declining cardiac function. Muffled heart sounds. Okonkwo didn't move. Her eyes stayed locked on Morrison. She turned to Bradford. Her expression transformed from shock to something like fury. You let her pretend to be a nursing student? Are you insane? Bradford's confusion was genuine. I didn't know. Who is she? Okonkwo's voice carried across the department, loud enough that every staff member could hear. Alex Morrison, Lieutenant Colonel, Chief of Trauma Surgery, Forward Operating Base Kandahar, 3 tours in active combat zones. She's one of the most decorated trauma surgeons in military history. The words hung in the air like smoke. "She's performed more emergency procedures under enemy fire than you've done in your entire career, Dr. Bradford, and you had her organizing supply closets." Morrison's jaw tightened, the only sign she'd heard. Her hands continued checking Twin A's vitals. "Dr. Okonkwo, Bay 14. Now, please." The staff exchanged glances, shock, confusion, awe. The whispers started immediately, quiet but spreading like wildfire through the department. Lieutenant Colonel, combat surgeon, Kandahar. Everything suddenly made sense. The precision, the authority, the impossible. Competence. This wasn't a nursing student who got lucky. This was a trained combat trauma surgeon operating at the peak of her abilities, 38 minutes in. Morrison finished stabilizing another patient in the main ER. Bradford approached as she documented her interventions on the tablet. His voice was quiet now, almost gentle. "Why didn't you say anything?" Morrison didn't look up, kept writing. "Why are you here dressed as a student?" Her hands paused, just for a second, then continued documenting. "Because I'm not a surgeon anymore, Dr. Bradford." She closed the tablet, met his eyes. "I haven't been for 2 years." The trembling started then, small, almost imperceptible. But there. Her fingers shook as she set down the tablet. The adrenaline that had carried her through the last 40 minutes was beginning to fade, the iron control beginning to crack. Morrison turned away, walked toward the supply closet, each step measured, controlled. But her hands betrayed her, the tremor growing. With each second, Bradford watched her go, saw the shake in her fingers, the slight hitch in her shoulders. Behind her, the ER continued its now efficient operation, patients stabilized, staff working in synchronized rhythm, the crisis contained. But Morrison's hands trembled, and for the first time since she'd taken command, the armor showed its first crack. 47 minutes in, the initial wave was stabilized, 28 patients saved, 3 still critical but holding. The organized chaos had settled into something manageable. Residents moved with purpose now. Nurses worked in coordinated teams. The department breathed with a rhythm Morrison had imposed through sheer force of will. She sat alone in the supply closet, hands still shaking, eyes closed. The sounds of the ER faded. Monitor beeps became helicopter blades. Voices calling for medications became voices shouting coordinates. The antiseptic smell transformed into desert dust and copper blood. Kandahar province. 2 years ago. Morrison stood in combat fatigues, blood splattered across her chest, her arms, her face. The surgical tent was barely more than canvas stretched over poles. The operating table was a folding metal surface covered in sterile drapes that weren't sterile anymore. Nothing stayed sterile when mortar rounds landed close enough to shake the ground. "I need more blood. He's crashing." Her voice, younger then, steadier. Before everything broke, the explosions came in waves, close enough to rattle surgical instruments, close enough to make the overhead lights swing, close enough that dirt filtered down from the tent ceiling onto her sterile field. She didn't stop working. The soldier on her table was barely 19, babyface still showing through the dust and blood. His name tape read Martinez. Private First Class Daniel Martinez, shrapnel wounds to the abdomen, damage to multiple organs, the kind of injuries that killed people even in well-equipped hospitals. Out here, in this tent with limited supplies and incoming fire, the odds approached 0. Morrison worked anyway. "Don't you dare give up on me, Martinez. Stay with me." Her hands moved with precision, clamping vessels, controlling bleeding, repairing damage faster than it accumulated. She'd done this 63 times in the past month, 63 soldiers on her table with injuries that should have been fatal. She'd saved 46. Martinez's vitals dropped. The monitor's tone changed, higher, urgent, then continuous, flatline. No. Morrison's hands moved to compressions, pressing down on his chest with rhythmic force, counting in her head. 30 compressions. Breathe, 30 more. Come on, nothing. Another explosion. Closer this time. The tent shook violently. Someone shouted that they needed to evacuate, enemy fire getting too close. Morrison ignored them, kept working. Compressions, medications, defibrillation, everything in her arsenal thrown at the problem of Martinez's stopped heart. 5 minutes after protocol said to stop. 10 minutes. 11. Her hands were covered in his blood. His chest was bruised from her compressions. His young face was still empty. Private First Class Daniel Martinez, age 19, time of death 0347 hours. He was the 17th soldier she lost that month and the last one she could handle. Morrison broke that night, not during the surgery, not immediately after. She'd finished her shift, treated 6 more patients, saved 4 of them. Then she'd walked back to her quarters, closed the door, and collapsed. Complete psychological collapse. She didn't remember most of the next 72 hours, fragments only. Someone finding her, medical evaluation, emergency psychological assessment, words like acute stress reaction and post-traumatic stress disorder and combat fatigue, medical discharge, honorable, with commendations, with medals, with gratitude from a grateful nation. She walked away from medicine entirely, couldn't look at a scalpel, couldn't hear monitor alarms, couldn't close her eyes without seeing Martinez's face. 19 years old and dead because she wasn't fast enough, wasn't good enough. It should have been 44. The supply closet door opened. Morrison didn't move, didn't open her eyes. She knew the footsteps. Alex, Dr. Okonkwo's voice, gentle, careful. I know that look. You're thinking about Kandahar. Morrison's eyes opened, stared at the shelves of medical supplies, bandages, IV bags, the mundane equipment of civilian medicine. I killed him, Patricia. Her voice was barely a whisper. Martinez. I wasn't fast enough, wasn't good enough. He was 19 years old, and I let him die on my table. Okonkwo sat down beside her on the floor. 2 surgeons in a supply closet surrounded by the tools of their trade. You saved 43 soldiers that month, 43 people who went home to their families. Morrison's hands clenched into fists, still shaking. Should have been 44. The silence stretched. Outside, the ER continued its work. Patients being treated, lives being saved. The machine Morrison had built still functioning. Why are you here, Alex? Why nursing school? Why pretend to be someone you're not? Morrison took a breath. Let it out slowly. I thought I could come back slowly. Start at the bottom. Learn everything again like it was new, like I'd never held a scalpel before, like I'd never lost anyone. She looked at her trembling hands. I thought if I could just be a student again, without the pressure, without the stakes, maybe the nightmares would stop. Maybe I could sleep without seeing his face. Maybe I could hold a scalpel without my hands shaking. Okonkwo watched her, patient, understanding. Alex, you just saved 31 lives in under an hour. You coordinated a mass casualty response that should have overwhelmed this department. You are a surgeon. You've always been a surgeon. Morrison shook her head. The trembling intensified. And what? Happens the next time I lose someone? What happens when I freeze again? When another Martinez dies because I'm not good enough? She looked at Okonkwo, her eyes wet now. I can't go through that again, Patricia. I can't. The alarm cut through everything, sharp, urgent, the specific tone that meant someone was dying right now. Footsteps sprinting, voices shouting, the controlled rhythm of the ER spiking into panic. The supply closet door burst open, a nurse, young, terrified. Dr. Morrison, the twin from earlier, twin A, he's crashing, internal bleeding we missed, Dr. Bradford doesn't know what to do. Morrison's face went white, all color draining in an instant, the child she'd saved, the 6-year-old boy she'd performed impossible surgery on, dying, her worst fear manifesting in real time. No. The word came out broken. She stood, tried to. Her legs weren't working properly. The hallway seemed to tilt. Okonkwo caught her arm. Alex, that child needs you. Right now. Morrison's hands were shaking violently now, not the small tremor from before, full trembling, the kind that made surgery impossible. I can't. Images flashing, Martinez on the table, the twin boy on the table, their faces overlapping, merging, 19 years old, 6 years old, both dying, both her responsibility, both her failure. What if I freeze again? What if my hands won't stop shaking? What if I kill him? Okonkwo grabbed Morrison's shoulders, forced eye contact. You won't, because you're the best I've ever seen, and that little boy deserves the same chance you gave Martinez. The words hit like a physical blow. Martinez didn't have a chance, Patricia. The wounds were too severe. The conditions were impossible. That child has a chance because you're here, because you can save him. But only if you move. Right now. Morrison stood at the threshold of the trauma bay. Through the window, she could see the organized chaos inside. The monitor screaming, the child's small form on the table. Bradford backing away, his hands up, his face showing the helplessness of someone out of their depth. Her internal voice, the one that had kept her alive through 3 combat tours, spoke with cold clarity. One chance, one moment, one decision, she could walk away, maintain the fiction that she wasn't a surgeon anymore. Let someone else handle this, protect herself from the possibility of another failure, another face to haunt her nightmares, or she could step forward. Morrison watched her hands, still shaking, still trembling with 2 years of accumulated fear and trauma. Then, slowly, the trembling stopped, not completely, not perfectly, but enough. She stepped forward, pushed through the door, her voice cut through the panic, cold, controlled, absolutely certain. Everyone out. The staff froze, looked at her. Everyone out, except you, Bradford. You're going to learn how this is done. She moved to the table, her hands reaching for gloves. Steady now, the fear still there, the trauma still present, but contained, controlled, transformed into fuel instead of paralysis. Morrison looked down at the child's face, pale, unconscious, dying. Not today. She wouldn't let Martinez's death be for nothing, wouldn't let her trauma claim another life. This child would live. She would make certain of it. Her hands moved toward the surgical field, steady, precise, perfect. Morrison's hands moved with absolute precision. This wasn't just competence. This was artistry. Bradford stood across from her, frozen in place, watching something he'd never witnessed before. Morrison worked with a fluidity that seemed almost choreographed. Each movement flowed into the next without hesitation, without doubt, without fear. Missed bleeder in the splenic artery. Her voice remained calm. Educational. She was teaching even as she fought to save a life. See here? Tiny tear. Easy to miss in initial trauma, but it'll kill him in minutes. Her finger pointed to the nearly invisible damage. Bradford leaned closer, his eyes widening as he understood. He'd missed it. His entire team had missed it. This microscopic injury would have killed the child within the hour. Clamp. There. Morrison's hands guided the instrument with perfect accuracy. Suture. Watch the angle. You go too deep, you rupture it further. Too shallow, it won't hold under pressure. Right there. That's the sweet spot. Bradford was mesmerized. His earlier arrogance had evaporated completely. Now he was a student watching a master, taking mental notes, recording every movement, every decision, every technique. Morrison worked in silence for 90 seconds, her breathing steady, her hands absolutely stable. The trembling was gone, completely, as if it had never existed, the tear repaired, the bleeding controlled, the child's vitals climbing. 4 minutes, 12 seconds, the monitoring alarm silenced, the frantic beeping transformed into a steady rhythm. Strong, regular, the sound of a heart that would keep beating. Morrison stepped back. Let the nurses take over the final stabilization procedures. She stripped off her gloves with 2 precise motions and dropped them in the biohazard container. Then she looked at her hands, turned them over, palm up, palm down, fingers spread, fingers curled, steady. For the first time in 2 years, after saving a life, after the adrenaline and the fear and the impossible pressure, her hands were steady. She closed her eyes. A single tear tracked down her cheek. Bradford's voice broke the moment. Quiet. Awed. I've never seen anything like that. Morrison opened her eyes, looked at him, the tears still wet on her face. You just saved that child, Dr. Bradford. You assisted me. That means you can do it again. Bradford blinked, shook his head slightly. I didn't. You did everything. I just stood here. No, you were part of the team. You learned. Next time you'll remember. The time after that you'll teach someone else. That's how this works. She walked, past him toward the door. Paused. Check on Twin B. Make sure there are no complications we missed there, too. Bradford nodded, moved toward the other bay, but his eyes kept returning to Morrison, watching, learning, understanding that he'd witnessed something extraordinary. 93 minutes in. The mass casualty event was contained. Patients stabilized across the entire department. The initial chaos transformed into organized recovery. Morrison moved through the hallways, checking on cases, reviewing charts, ensuring nothing was missed. Bradford caught up to her near Bay 15. "Dr. Morrison." She turned, waited. "I owe you an apology." Bradford's voice was formal now, professional, but underneath, genuine remorse. "I dismissed you, mocked you. I put patients at risk because of my ego and my inability to recognize competence when I saw it. You saved lives I would have lost, multiple lives, and I treated you like you were beneath me." Morrison studied him for a long moment. "You were overwhelmed." "It happens." Bradford shook his head firmly. "No, I was arrogant. I let my position make me believe I knew everything. I stopped learning, stopped listening. That's not being overwhelmed. That's being a bad doctor." He extended his hand. "I'd like to learn from you. If you'll teach me." Morrison looked at his outstretched hand, took it. Firm handshake. "Professional. First lesson. When you don't know something, say it. Ego kills patients faster than any disease." Bradford nodded, released her hand, started to walk away, then turned back. "How did you do it? How did you see things the rest of us missed?" Morrison was quiet for a moment, considering. "I operated in conditions where missing something meant soldiers died. You learn to see everything, to trust nothing, to verify everything twice. It's not genius, it's survival training applied to medicine." She continued down the hallway. Bradford followed, still learning, still watching. The elevator doors opened. Dr. Helena Voss stepped out. Hospital chief of surgery, 28 years of experience etched into her confident posture. She wore a white coat with her name embroidered in blue thread, director of surgery, the authority in the building. Her eyes swept the ER, took in the organized chaos, the stabilized patients, the exhausted but functioning staff. "I heard we had a mass casualty event." Her voice carried across the department. "And I heard someone not on staff ran my entire emergency department." She walked directly to Morrison. No hesitation, no uncertainty. "Lieutenant Colonel Alexandra Morrison, your reputation precedes you." Morrison's jaw tightened, the familiar discomfort of recognition. I was just helping. I'm a nursing student." Voss smiled, not unkindly, but not buying the deflection either. "You're a trauma surgeon, one of the best in the country. 3 tours in Kandahar, chief of trauma surgery for forward operating base operations, 217 successful emergency procedures under combat conditions. Decorated, honored, legendary." She paused. Let the words settle. "And I'm offering you the position of director of emergency medicine, effective immediately." The hallway went silent, staff pretending not to listen while hanging on every word. Morrison shook her head, stepped back slightly. "I can't. I'm not ready. The PTSD, the nightmares. I haven't practiced civilian medicine in 2 years. I can't take that kind of responsibility." Voss moved closer, her voice dropping but remaining firm. "You just coordinated care for 58 patients, 0 deaths, 0. In a scenario that should have killed a dozen people minimum, you transformed a failing emergency response into a textbook mass casualty operation. And you did it in under 2 hours. Dr. Okonkwo appeared from one of the bays, joined the conversation without invitation. "Alex, you've been ready. You just needed to remember who you are." Morrison looked around the ER, patients in various stages of recovery, staff exhausted but alive, moving with the efficiency she'd taught them, the twin children sleeping peacefully in pediatric observation, the 9-year-old girl from Bay 7 stable and surrounded by family. "What if I freeze again?" Her voice small now, vulnerable. "What if there's another Martinez? What if my hands shake and someone dies because I can't handle the pressure?" Voss stepped closer. "Put a hand on Morrison's shoulder, then you'll have an entire department to back you up. That's what teams are for. That's what systems are for. You don't have to be perfect. You just have to be excellent." "And you are." Morrison took a breath. Let it out slowly. Looked at her hands one more time. "Steady. I have conditions." Voss smiled, knowing she'd won. Name them. I want to build a program for combat medics transitioning to civilian medicine. Full support, funding, resources. Too many veterans leave military medicine and can't find their place in civilian hospitals. I want to change that. Done. What else? Mandatory PTSD screening for all trauma staff, regular psychological evaluation, support systems. We can't help patients if we're broken ourselves. Voss extended her hand. Done. When can you start? Morrison looked at the organized chaos around her. The department she'd built from disaster in less than 2 hours. The staff who now looked to her for guidance. The patients alive because she'd stepped forward when everything in her wanted to run. A small smile. Genuine. The first real smile in 2 years. I think I already did. The vindication came in waves after that. Nurses who'd questioned her earlier approached with quiet apologies. We had no idea. We're sorry. We should have listened. Morrison accepted each apology with grace. You didn't know, but now you do. And next time, don't assume. Ask questions, verify credentials, but don't dismiss people based on appearances. Bradford gathered the staff for an impromptu announcement. Dr. Morrison will be leading grand rounds on mass casualty protocols starting next week. I expect everyone here to attend. What we witnessed today was a masterclass in emergency medicine. We'd be fools not to learn from it. The staff nodded. Respect earned through demonstrated excellence. No more questions, no more doubt, just recognition of undeniable competence. 6 months later. Morrison stood at the front of a lecture hall in professional scrubs, white coat pristine, badge reading Director of Emergency Medicine in clear lettering. The room held 40 residents and nursing students, a mix of military veterans and civilian trainees, all eager, all attentive. The whiteboard behind her displayed neat writing, triage protocol, combat to civilian applications. Morrison moved through the material with confidence, her voice steady, her examples drawn from real experience. She didn't hide her military background anymore, didn't diminish her expertise. She owned it, used it, transformed trauma into teaching. A hand raised in the aisle, 3rd row. Young man, maybe 25, military haircut still fresh, combat medic insignia tattooed on his forearm. Dr. Morrison. I'm struggling with the transition from field medicine to hospital setting. Everything feels wrong, too slow, too bureaucratic. I keep second-guessing myself. Morrison nodded, recognized the look in his eyes, the same look she'd seen in her own mirror for 2 years. Stay after class. We'll talk. I know exactly what that's like. She looked out at the class, saw herself in their faces, the doubt, the fear, the desperate hope that they could be useful again, that their skills mattered, that their trauma could transform into purpose. They could. She was proof. Morrison walked through the ER after the lecture. Staff greeted her with respect, genuine warmth. She'd earned it, not through authority or position, through demonstrated excellence day after day, through teaching, through caring. She paused at Bay 7, the bay where everything changed, where a 9-year-old girl had coded and Morrison had stepped forward instead of running away. The curtain pulled back. A woman stood there, early 40s, tired eyes, but genuine smile. Dr. Morrison, the girl's mother. 6 months later, following up on routine post-trauma care, you saved my daughter. She moved forward, embraced Morrison without asking permission, held tight. Morrison returned the embrace, let herself feel it, the gratitude, the connection, the reminder of why this work mattered. She saved me too. She just doesn't know it yet. The mother pulled back, confused. Morrison smiled, gentle, knowing. Sometimes we save each other. That's how it works. The mother nodded, not fully understanding but accepting. She returned to her daughter's bedside. Morrison continued her rounds, checked vitals, reviewed charts, consulted with residents, taught, learned, lived. Her hands were steady. Her smile was genuine. She was home. Not the home she'd left when she deployed to Kandahar, not the home she'd tried to build as a nursing student hiding from her past, but a new home, built from trauma and triumph, from loss and redemption, from the understanding that excellence wasn't about perfection, it was about showing up, about stepping forward, about transforming pain into purpose. Martinez was still gone, would always be gone. 19 years old and dead on a surgical table in a tent that shook from explosions. But he wasn't the last anymore. He was part of a story that led here. To this ER, to these patients, to this life Morrison had rebuilt from the wreckage of her trauma. She walked toward her office. Director of Emergency Medicine etched on the door, stopped, looked back at the department, the organized, controlled chaos of an ER functioning at peak efficiency. Her department, her team, her home. Morrison smiled, stepped inside, and closed the door on the past,